Having a blessed afternoon. I am having a blessed afternoon. I want to thank you so much for being here with me, and I really appreciate it that this channel is really growing and the information is getting out amongst us as we tackle a lot of situations that's going amongst the indigenous people of the earth and just all people all around the world of dealing with this malfunctional disorders that's in the brain, that's dealing with autism, dealing with Down syndrome, dealing with all of these conditions and disabilities that is upon our children all around the world, right? So um, these neuroscientists and neuro surgeons and all of these other people has come up with a scientific terminology to basically to explain where these defections and these disorder come from, and they blaming it on Neanderthal syndrome, Neanderthal mindset. When there men, when there was men that creation that was living in a state that didn't have a state of mind, that didn't have a state of understanding, that didn't know anything, right? Um, this is a lie because people want to keep procreating this Neanderthal state, that saying that men was in Neanderthal state. This is a lie. Mankind was not in a Neanderthal state. We was always blessed with knowledge, wisdom, and understanding. Right. That's first and foremost. And first and foremost, right, the Creator has blessed certain civilization to educate and to civilize all civilizations around the world. So there was never a state of where people were living in a state of savage. Do you understand that? Savage. Living savage. Procreating with animals, procreating with any and everything. People was procreating with animals and doing these acts. These acts basically, right, was practiced amongst this entity. The entity was having intercourse with animals. This entity. You see, a lot of this information is not going to be told to you because it's very dark. It's a very dark, and this is way before mankind was in existence. This entity existed way before mankind was put into existence upon this earth. This entity used to kill and have intercourse with animals, taking on animal forms. Do you understand that? This where this ability came from. It didn't come from a human being. It was taught by this entity to do things like that. That's why the creator always talking about animals and human beings. He always talk about that in scriptures. So you can get a visual point on what he's talking about and why he destroyed the earth. You understand where I'm coming from? So we know of this behavior, right? And we're gonna speed this up. Where did this malfunction come from? Where did this disease come from? Where did this plague come from? From children having a disorder upon their brain, right? A disability upon their brain. And I can see if it be one child, there's many different trials there. There's many different children there that suffering with this disorder, right? This disability, right? In the stage of forming a brain and forming into a actually person. Why is this taking place? And at Pacific time, all these children go through this process of these children going through this malfunction disability upon their brain. Basically, you ask yourself, right, where's this coming from? 50 years ago, there wasn't none of this ever talked about. It wasn't talked about because it wasn't no problem. Only when, right, when mankind started procreating these horse pills and these medicines that the women's go to prenatal care, right, when they are pregnant and the baby's in the womb of the mother, and they taking all these shots, they taking all of these vitamins. They say that these are vitamins so the baby don't come out with Down syndrome or the baby don't come out misdeformed or all of this other stuff. Where did that come from? Where did this come from? Because I remember years ago, the woman didn't have to take no pills and vitamins so the baby doesn't become deformed. This is lies. That means that you procreated, right, something to affect these child's brain when it's forming, right, inside the child, so the child can learn. It's a special part of the brain that's what? That's disabled. Let's check it out. People doing this for like, share, subscribe, and so they can get paid. So this is why this part of the brain, and this is why this part of this disease and disability was procreated so people could get money, so people could study your brain. You understand where I'm coming from? So people could study your brain. After years and years and years becoming an organ donor, right, and your blood being tested, and your heart being tested, and your lungs being tested, right? In these laboratories, you got to come up with some type of chemicals, right? And some type of ways and actions to affect the baby as they form it in their mother. And this is exactly what happened. This is exactly what happened.
So they're almost like birds' nests or a tangle of blood vessels that are located in the brain. There are many, many arteries that typically go into AVMs that feed the AVM with blood, and there's large veins that drain the AVM of blood. We don't really know why AVMs form, but they do form at 8 weeks in gestation. When you're in your mom's belly, when the blood vessels of the brain are forming, that's when AVMs typically form. They usually present clinically or to physicians, and it can be varied, but usually around 20 years old or even like 40 years old. There could be no symptoms with AVMs, but the symptoms that we commonly get patients referred for can be headache, and it's not your sort of normal headache, but it'd be sort of a persistent, severe headache. People can have seizures, and the biggest sort of feared thing that AVMs can do is cause bleeding in the brain. That type of symptom is not very mistakable. It's a very, very sudden, severe headache. So if that happens, we recommend that patients go to the emergency room very quickly. There are many treatment options. The first one is good old-fashioned surgery. We actually make an incision on the scalp, we remove a small window of bone, and we resect.
See? Good old fashioned surgery. That's their thing. Surgery. They want to do surgery on a live body, on a live baby. You understand what I'm saying? 8 weeks until the child is forming. That's where this condition start to affect the child brain, right? This malformation that forms inside the brain. What activate this? What activate these veins? What activate these nerve systems that's in the brain? What activate this? What activate this is the things that the women are eating in our neighborhoods, right? And then when you do prenatal care, it's those pills. They're not gonna tell you that in these shots and whatever else that you're taking, right? To say that oh nah, you taking this because the baby might come out with Down syndrome, or the baby might come out malnutrition, or the baby come out, these are vitamins. I never heard of that. I never heard of that. When I was coming up, I never heard of these women taking these big horse pills and taking these certain things to say that the reason why they taking these pills is to prevent the baby from becoming with Down syndrome, right? Autism, and any other disability that's going to affect the child, the growth or development of the child. This was procreated, right? So people can do what? So people can study live babies, live individuals that go through these traumas and depression upon their brain that triggers at a certain level. It triggers because it's the thing that you eat, right? And then it also as when the mother is doing treatment for prenatal care, it starts to form because she's putting abnormal vitamins, abnormal things inside of her body that are supposed to be there. I remember years ago, right, in our community, the indigenous community, these queen sisters, they didn't use none of these pills. They didn't use anything. You understand where I'm coming from? Where did these pills come from? Where did this stuff come from? What these things do, these stuff is procreated so it can produce Down syndrome. It's no Neanderthal DNA. It's no Neanderthal DNA. And I'm about to drop some knowledge on you. When a child dies, right, or when somebody dies, right, what happens is that the cells in your brain become dead. Everything becomes dead, right? So the liquid and everything that's flowing through the brain becomes dead all at once. That's what you ever heard of brain dead? Brain dead is like um everything goes blank at that very moment, and that portion of the brain goes blank. It goes dead. Do you understand that? Which can form what? Ulcers on your brain tumors, headaches, and all of these other things. So if I can form in a laboratory pills mix them with vitamins, mix them with other things, and tell you that this is something that's going to help your child growth and development. So prevent them from Down syndrome, prevent them from autism, and any other of the disabilities. Right? You're going to take it. You're going to take it at your own risk. You don't know that because you dumb, deaf, and blind. You dumb, deaf, and blind. If you can compare the babies being born, right, 50, 60 years ago and the babies that's being born now, right, you can see the big difference and the big change in the makeup of the brain. See, at that time, the baby's forming, the brain is forming. So you can use certain chemicals, right, to aggravate the brain. If I put certain things in it, it will attack this certain brains. And they've been doing this for years and years and years and years and years. Now they saying that this comes from the Neanderthal DNA. This is lies. This is lies. This is lies. So if it came from Neanderthal DNA, why didn't it happen 60 years ago? Huh? Why didn't it happen on a larger scale 60 years ago? Why is it happening on a larger scale now? Why? Ask yourself that. Ask yourself that. These questions that you need to ask yourself, especially as mothers, because you are the ones that's going to prenatal care, right? And taking these pills and taking all of these things that these individuals suggesting to you. And I'm gonna keep it real with you. This is something to think about to all the mothers, to all of the mothers around the world. Okay? This is an actual true fact. You don't have to believe me or not because they're not going to tell you the truth. They're not going to tell you the truth. But this is why all this stuff goes on.
And using microsurgical techniques. The second option, we go up through the groin with a catheter or a small tube, and we go into those small blood vessels of the brain, right to the point where the blood vessel meets the AVM. And we can actually inject small particles or glue substances that go into the AVM to block off the blood supply. And then the third option is something called gamma knife radiosurgery, which is a very focused type of radiation that we deliver to the AVM that over about 2 to 3 years sort of slowly melts the AVM away. Patients typically present in one of two ways. One is for an elective treatment. So that's where I see a patient in my clinic. We talk about different forms of AVM treatment, and then we actually perform that. Very different scenario than when patients come in when they have a bleed from an AVM. That's more of an emergent situation. In those situations, patients and families can expect a rapid hospital workup and course where we actually get imaging studies. And sometimes even emergent surgery is required in those situations. There are many, many.
See what it is that you need more organ donors. You need more organ donors. You need more fresh brains. You need more organ donors. You need more organ donors. So by procreating murder, death, kill, barbaric, evil, twisted inside of the community and creating false narrative, Now you got bodies. Now you got blood. Now you got all of these things where that you can study in these laboratories, right? Will give you a better understanding of dealing with these certain things, you know. But in order to have a live, you need a live body. You need a live body in order to study. In order to study this, so what you do, you got to procreate chemicals, put it in food, put it in here, put it in there, and then over time, what happens is that it'll be in your DNA because it'll start procreating. It'll start procreating within food, within these certain medicines, within these certain shots. You know, after years and years procreating with each other, it'll start coming. It'll start coming. You talking about Neanderthal DNA? No, that's from a person that has passed on, and their brain cells is no longer in effect. It's dead. You understand what I'm saying? That's what happens. So you within procreate within food, within vitamins, these things in these very neighborhoods that is plagued with diseases of murder, death, kill, of drinking, alcohol, cigarettes, smoke, and all of these other things which we are plagued with in our community, in our societies all around the world. I've never seen this much alarming um disabilities in my life. Autism, all of this stuff, man. All of it. Where did it come from? This just ain't just come out of the clear blue, out of the sky. This was procreated. So people can run up a bag. So people can go to school to become a doctor. These individuals already was going to school to become a doctor, to do these certain things. You understand where I'm coming from? Uh, um to become these surgeons and scientists so they can study the brain, stuff like that. They did that years ago. So it's now being that they studied this and studied that years ago. Now it's time to activate this into people. So after you keep procreating in your very DNA, this stuff is being pumped into our babies. And this is where that this Down syndrome, right? And autism and all of this other stuff, which is procreated for the destruction and demise of mankind all around the world. You procreated this. That's procreation. It's called population control. This is all population control. I want you to look at this. I want you to look deeper, deeper, deeper in this. Okay? Now it's up to you, ladies, because you carried the baby. It is your decision. It is your decision. All I did is made an assessment from a spiritual realm, from a spiritual guidance. 60 years ago, 7 years ago, these women wasn't taking them pills. They wasn't taking no pills. They wasn't doing that. They was not doing that. The babies came out fine. Their minds came out fine. They ain't come out with no disabilities and things like that. No, it was not. It's the food, the chemicals, and things that's being produced now in society, which is going to affect your reproduction system and your nervous system. You see, people like to play on dumb, deaf, and blind, and uneducated. And when they do that, they can spread the ignorance amongst our societies, our communities. And this is an actual true fact. This is something to think about. So I would like for you to share this amongst what? Amongst your friends and family. Share this, get the information out. There's something to think about. Because none of this stuff, this ain't just come up. You understand where I'm coming from? This had to be already in the making for years and years and years and years and years and years and years. Now it's time to activate so people can get paid. Just think about it. That's all I'm saying. Think about it. Peace, y'all. Peace.